Good evening, everyone, and welcome to the Healthy Community segments of Muncie Pride. My name is Rachel Thompson. I'm the Senior Organization Development Consultant for Indiana University Health. Each year, Indiana University Health is honored to have a community LGBTQ healthcare seminar. And this year, our fourth year of hosting this seminar, we're so lucky to be able to have it in this virtual environment with Muncie Pride. So I would like to thank the Muncie Pride Committee that allowed us to present during this time. And I would also like to welcome our main presenters this evening, Bree and Ty, who will be presenting on HIV and the use of PrEP. Thank you and enjoy your evening.
Good evening, my name is Bree Green and I work for Aspire Indiana Health. I'm the supervisor for infectious disease testing services. Tonight, I wanted to have a quick discussion about HIV. We're going to cover what HIV is, how it affects the body, services that are available to someone that tests positive for HIV, what testing looks like in this community, and prevention for HIV. So to get started, HIV stands for Human Immunodeficiency Virus. HIV affects the immune system. The immune system keeps your body safe and free of germs that may enter. HIV can take 1 to 3 months to show up on a test. There's a myth that HIV can take weeks, months, years, but HIV does show up on a test 1 to 3 months. HIV is transmitted through blood, vaginal fluid, semen, breast milk, spinal fluid, and anal fluid. So there's a lot of myths about HIV transmission. In the last 30 years, HIV has come a long way. So people used to think that HIV was spread through the sharing of utensils, sharing of bathrooms, sharing of water fountains. That's not the case. It's only spread from person to person through bodily fluids. HIV has many services that are available for someone that tests positive. There are care coordination services that help an individual get to their medical appointments, to the pharmacy, make sure that they take their medication regularly, and to check in with them frequently. So someone that is diagnosed with HIV has a lot of services available to them. There is no cure for HIV, but it is completely treatable. HIV medication is taken once a day, and that helps to boost the immune system and reduce the amount of the HIV virus that's in the body. Someone that is diagnosed with HIV would take this medication daily in an effort to reduce the risk of HIV turning into AIDS. AIDS stands for Acquired Immune Deficiency Syndrome, and AIDS is simply the progression of the HIV virus. So it is the exact same virus, just progressed. Someone that is diagnosed with AIDS would take medication daily with the same goal in mind, to increase their immune system and live a healthy, normal life. HIV testing is available in this community through Aspire Indiana Health. Testing is free, confidential, and results are available within minutes. It's simply a finger stick, 1 drop of blood, a few questions, and then any services that are needed afterwards. HIV has many ways to prevent it. One way being condoms, making sure that the condoms are not expired, have not been in the sun, have not been kept in wallets. And then another way is also PrEP.
My name is Ty Osborne. I am the PrEP navigator for IU Health Positive Link, and I am located here in the Muncie community. my job as a PrEP navigator is to help people who are interested in PrEP. I field questions they might have, as well as just really talk them through the process, and I get them hooked up with a physician, typically in our PrEP clinic. So I wanted to talk to you a little bit about what I know most about PrEP. As Bree was saying, it is pre-exposure prophylaxis. Basically, PrEP is a medication that reduces the risk of transmission of HIV when it's taken properly. People who are at risk for HIV can mean a lot of things. It's typically defined if you're having unprotected sex with an HIV positive partner or someone with an unknown status, or if you have multiple sexual partners. Indiana State Department of Health identifies if you had 10 or more partners in the last 12 months, or if you've been diagnosed with an STI, typically in the last year, or also anyone who's sharing needles or syringes, they would be considered at risk as well. One major misconception about the risk of HIV would be people think that if you have a certain sexual orientation or you have a preferred sexual position that you're not as likely to get HIV, but that's not the case. It can vary based on sexual behavior, but there's just a lot of misconceptions about it. PrEP in general is out there it can help anybody who is at risk, not just any one group of people. And so people want to know, like, why is PrEP such a big deal? Why I thought this HIV thing isn't a thing anymore. And it's like, no, HIV is still here. There's 1.2 million people in the US that have an HIV diagnosis. So it's important to protect yourself because HIV still is very prevalent, and PrEP can be used as one tool in your sexual health toolbox, as well as condoms and other things that you would use to protect yourself. Before 2012, we didn't have anything that could protect you before you got HIV. So the FDA just approved PrEP in 2012, so it's fairly new still, but there are already 2 medications that are approved. One is Truvada and one is Descovy. They're both made by Gilead. The difference in the medications is that Descovy is only approved if you are assigned male at birth, while Truvada can be used by anyone. They're both 99% effective if they're taken correctly. And the way you take it correctly is you take a pill a day, and it becomes fully effective after 21 days. There's a variation in how effective it is for what parts of the body are affected, I guess. So it typically in rectal tissue is in full effect after 7 days, blood is 14, and then vaginal is 21. So personally, I always tell my clients after 21 days, you're good. So a lot of people want to know, like, it's not just a magic pill. It's like, how does PrEP work? PrEP, basically, as Bree kind of touched on, your immune system, you have CD4 T cells, and when HIV is introduced into the body, it attacks those cells and it duplicates itself, and then those cells go out and the process just happens over and over again. And eventually the immune system is overwhelmed, and that's when you have an HIV infection. So what PrEP does is it protects those T cells. And so if HIV is introduced into the body, it will not allow it to attack those cells, and it doesn't duplicate, and therefore you don't have an HIV infection. So it's pretty straightforward. A lot of times I get calls of people who are interested in PrEP, and people want to know, how do I get started? How can I learn about PrEP? There are PrEP navigators. You can look on the Indiana State Department of Health website. You can really Google it, and you're gonna be able to find a PrEP navigator pretty easily. They're all over the state. Personally, we have IU Health Positive Link has a clinic here in Muncie. We're located at the Liberty Corner facility out on Jackson. And once people call me, I sit with them and talk with them and go through just all the options we have in regard to PrEP. One thing that people often think, which is definitely not true, PrEP is not a cure for HIV. There's no cure for HIV, but PrEP can protect you. It doesn't protect from other STIs, so that's important to know. So you still want to, as I've said before, use things like condoms. And it's not a morning after pill. It's not birth control. It doesn't help with anything like that. It's going to be zero effective. So when I sit down with clients or patients, I come up with a lot of questions that get asked a lot of the same things. So I was wanting to go over some of those today. One thing that people have asked when I've worked with transgender individuals, they want to know if PrEP can interfere with the hormones they're taking, and it doesn't. So it's safe to take hormones, it's safe to take PrEP all at the same time. Like, it's not a problem. Same with birth control. It doesn't affect birth control. It doesn't make it any less effective, so it's completely fine to take at the same time. Another thing are side effects. Everybody wants to know, like, what are the side effects? So typically, PrEP doesn't have a lot of side effects that are long-term, no long-term health issues in most people. Some people do experience some things like headache, some stomach cramps, just some light symptoms that often go away after 2 to 4 weeks. Most people don't have any issues with it at all. There are some more severe symptoms, some kidney and liver issues, as well as bone density issues, which is why it's so important that you continue to follow up with the your primary care physician or with the doctor at the PrEP clinic. And you'll follow up every 3 to 6 months, just depending on where you're at in your process, and they'll make sure that you are healthy and that things are still going okay. And if they're not, they'll address it. Another thing that people always ask, and it's a big one, is how much is it going to cost me? Can I afford PrEP? And typically, most insurances cover PrEP or cover most of it with a minor fee, sometimes just a little copay. Gilead also offers a copay card, which covers the cost of PrEP, or at least covers most of it. The Indiana State Department of Health also has a program referred to as PrEP MAP, which is based on your income, but it also helps cover the cost for a lot of people. So in most cases, it's pretty affordable, little no cost, and that's what a PrEP navigator can help you do if you are interested. So I mean, overall, PrEP can be a really useful tool. It helps decrease your stress and worry about HIV transmission. While we're talking about sexual health, something that I guess some clients that I've talked to lately have really been interested in is kind of how we can navigate intimacy and sex during COVID. Because COVID, everybody knows about it. We all know how you get it. We know that COVID can be spread through droplets. You can spread it coughing, sneezing, even just talking to people. We know that it's recommended that we social distance 6 feet or greater, wear a mask, but how do we navigate being intimate while we're wearing a mask and staying 6 feet apart from people? So that's been a question on a lot of people's minds. During the height of COVID in New York City, the health department, they recommended that people not have sexual partners outside of their household, no kissing, no sexual positions that have people facing each other. And also they stated that your safest partner is yourself. And while that's all great, it definitely limits what you're able to do. It can definitely interfere with sexual satisfaction. So realistically, the strategies you would use to navigate this in COVID times basically would be based on your personal experience, what's going on in your personal life. If you have one partner, you're living with them, it's not going to be much more than a conversation, like understanding the risks they've had at work or school, if they've been wearing PPE, kind of how all that's going. But it gets a little tricky when you're dating, you want to meet somebody new. The Kinsey Institute found that people since March have been using online dating platforms a whole lot more, and even more interestingly, they're using them longer. So people are waiting to meet in person. They're having virtual dates. They're watching a movie together on Zoom or something like that. So they're finding that people aren't meeting as early. And then if you're able to figure out a person's exposure at that point. We do know, besides coughing, sneezing, things like that, that COVID can also be found in bodily fluids, including semen, vaginal fluid, rectal fluid. So it's important still to use condoms. There's more research that's needed before we really know how exactly it can be spread sexually, but in the meantime, treat it as you would any other STI. Mainly just ask the person like you would their HIV status, know their COVID status, know if they've been tested, if they've been exposed. It's just important to know this about people right now. And you can also, people have had to get more creative, like sending text or photos or videos to each other, preferably in an encrypted platform. But these are other things that people can do instead of getting together in person. So, well, thank you for joining us tonight and letting us talk to you about HIV and PrEP and sexual health during COVID. I hope that you learned some things. If you have any questions, feel free to email Bree or I at our email addresses below. Or you can also, if you're interested in getting HIV tested, you can also schedule those online, or you can contact Bree as well and let us know if you have any questions.
Happy Pride.